Are there any downsides at all, would you say, from the anterior approach? Is there any other risks, vascular risks to the arteries and whatever, the femoral artery and those sorts of things? Is that a factor? How much of a factor is it?
Yeah, so any operation to the hip joint, there are different risks that you need to consider. Anterior approach surgery, I feel, is has a good safety profile in terms of risks, but there are potential risks. Any approach runs the risk of damaging to nerves. The bad news is if you have a standard hip replacement, a posterior approach, or indeed actually a hard hinge approach, there is a risk to damaging the sciatic nerve, the major nerve at the back of the hip joint, which supplies muscle throughout the leg. The anterior approach that I use, there's one nerve at particular risk, which is the lateral cutaneous nerve of the thigh, which is a sensory nerve only. It supplies the skin on the outside surface of the thigh, and there is a percentage of people that will complain of numbness on the outside of the thigh. If I was going to have a nerve injury as a result of a hip replacement, and I had a choice between a sciatic nerve palsy or an injury to the lateral cutaneous nerve of the thigh, I think I know which one I'd prefer. I wouldn't want to have either of them, but I think that's a difference in profile.
Yeah.
There is some published data that indicates an increased risk of infection with the anterior approach compared to traditional surgeries. Some publications have documented a potential increased risk of excess blood loss as a result of the anterior approach. I think a lot of those issues relate to what we call the learning curve. So the ability for a surgeon to train to the point where he's perfectly safe to do the technique. As I said at the beginning, the technique technically is, I think, a little bit more challenging than a standard hip replacement. And so realistically, it's not something that you'd want to learn if you only do a few hip replacements a year. For the high volume surgeon, I think it's a perfectly appropriate and sensible way to do hip replacement surgery. Is there, for the majority of people, a big difference 6 months after surgery between a well-performed anterior approach hip replacement and a well-performed posterior hip replacement? No, I don't think there is a difference, apart from the cosmetic appearance of the scar, maybe. But in the early days, patient satisfaction scores are very high generally. As I said, if the surgeon is well trained and is using this technique routinely, I think the outcomes are very good. The risk profile is conducive